Okay, we're going to do an AP and a lateral hip. So for an AP hip, we're going to have a 10 by 12 cassette and portrait. I'm going to do a right hip. I got the right marker. I'm lined up. My collimation field is at 10 by 12. So when we do this, you want to be 1 to 2 inches medial to as is and 3 to 4 inches below. There are a couple little tricks that can get you here. There is, you can put the thumb on the as is, hover kind of your middle finger over synth, and then where your pointer finger ends up, or your second digit ends up, is kind of where you want your central ray to be. So then if I were to figure that out, that's about 3 to 4 inches below and about 1 to 2 inches distal. Another trick you can try, if you put your second digit right on as is, and then where your thumb ends up is where your central ray. Third trick that you guys will see done out in clinic is if you have your patient bend their leg up, put your finger right in the middle of their crease, have them relax their leg down, put you right in the center. So I personally like the thumb on as is, and then where my second digit ends up centered there, or the bend the knee up. You can see I ended up perfectly where I want to be. Next thing we need to do is go ahead and internally rotate 15 to 20 degrees. That's going to put the femoral neck parallel to the IR. You can see I have light past synth. We're concerned with getting that joint space, so you don't even have to be concerned that you're getting all of iliac crest on this, because we're concerned with that joint space. I would place GP either above the light field, or you can place it on the opposite femur. Measure directly through your central ray. Ask your patient to hold still and click. For a lateral, or you may also hear it referred to as a unilateral frog leg, you're going to flip your cassette, landscape. I'll put my right marker in the lower outer corner. I'm going to go ahead and adjust my collimation to match my film size. For this, you're going to have your patient bend their leg up and go ahead and bring it out about 45 degrees. The important thing here is make sure that both as is stay equidistant from the table. You don't want to end up rotating your pelvis. This one is going to be just 3 to 4 inches below the level of as is, or kind of right in the center of where your patient's crease is. You can also again do that trick where you put thumb on as is, get your middle finger over synth, and then right where your second digit ends up is your central ray. For this, you can leave your tube exactly how it is lined up, or you can also choose to turn your tube to follow the long axis of the femur for this. Either way is acceptable. Just make sure if you're going to turn the tube head that your bucky and your tube are lined up before you do it. Either way is acceptable. You'll probably see it done both ways out at clinic, so whichever you prefer, either one is fine. GP could go above or on the opposite femur. Ask your patient to hold still and click.